Thank you very much, Mr. Secretary, for that kind introduction. I thought you were going to say, I'm now going to introduce a guy who wears a suit and tie and is going to bring everybody back to class. So I am going to bring you back to class because I'm going to talk to you a little bit about a program that we started at Georgetown about 8 years ago called the Engelhardt Project, and it's named for a generous benefactor who enabled us to put this program into practice. And we developed this program as a way to expand and strengthen our campus safety net, the network of student affairs and academic affairs staff that's in place to support the well-being of each Georgetown student. We began the project because many of our faculty were seeing some of their students clearly struggling in one way or another, and they wanted to be of help. And the Engelhardt Project was developed as a way to more fully integrate our faculty into our campus-wide safety net. Through Engelhardt, we help faculty infuse health and wellness topics into their curricula. Through course readings, writing assignments, presentations by health professionals, and class discussion, students are able to build their awareness and knowledge about mental health and well-being. And further, the relationships built within this context between students, their peers, and their professors helps to create more awareness of and sensitivity to others who are coping with mental health challenges, and by providing appropriate language and opportunities to talk about the issues in a respectful and intellectually informed way. Students also become better equipped with the tools necessary for grappling with contemporary problems and issues. A couple of examples: introducing students to the biological underpinnings of depression, while also talking about recognizing outward symptoms, studying how cancer cells develop, while also hearing personal stories from campus community members who are cancer survivors. Over the last 8 years, the project has made a significant impact across our campus. Since its launch, more than 60 faculty have been involved, and we've reached over 7,500 undergraduates through 225 courses. We reach about 75% of each entering class by the end of their sophomore year. The intellectual underpinning of this project is the belief that the student-faculty relationship can be the most impactful relationship in a college student's life, and that with the right professional and institutional support, this relationship can have a profound effect on the overall mental well-being of students. By bringing topics of health and well-being into the classroom, the Engelhardt Project helps to give mental health voice, validation, depth, and dignity. In so doing, it helps to reduce the stigma that can be associated with mental health challenges, and it has also had positive effects upon the health and well-being of our students. As you'll see in a couple of slides that I'll share with you, students who've taken an Engelhardt course report being more comfortable asking for help for themselves and also for sharing resources with their peers. They also are thinking more before they act, reporting changes in behaviors already, and are more aware of their health and its importance to their own well-being. Students report an increased tolerance of other perspectives and an increased openness, awareness, and sensitivity to others. And they are breaking down stigma and stereotypes and becoming more attentive and reflective, relating course content to their own lives. In terms of lessons learned, 3 quick points. We believe the Engelhardt Project is successful because it meets our students on a different turf than those of our other health and well-being campaigns and initiatives. Traditionally, we've worked in our residence halls, in athletics, in student life. We've developed a comprehensive safety net through which we seek to recognize students who have needs and then referring them to the most appropriate places. By identifying a new context in which we could reach our students, the classroom itself, we're able to present a more comprehensive outreach approach. We capitalized upon the strengths of that new environment, that it's a place where students are already prepared to be intellectually engaged and where openness and dialogue are fostered. With Engelhardt, we simply developed a new context in which conversations and education about mental health could take place. Second, a key component of Engelhardt's success the partnerships that it has created across our campus. By more deeply integrating our academic, student affairs, and health personnel, and by uniting them in our shared mission, we're able to better leverage each of their strengths. And finally, is the importance of tying this work into the very mission and the core values of our institution. By connecting this work to values such as the education of the whole student, or in our context, the Latin words cura personalis capture the idea of the care for each individual student. By grounding this in the core identity of the institution, it has empowered our faculty and our student life and our athletics and our entire university community in a way that is true to our most authentic self. So it's a privilege to be able to share this with you today, and I look forward to our conversation this afternoon.